Hey everyone, it's Lisa Stokes again. I am here to give you our 6th week of our 8-week virtual series. I hope that you are enjoying the education and the workouts as much as I am. Don't forget, our goal with this series is to support you as coaches during this pandemic by providing education and resources to help you stay active, take care of your body and mind, and prepare for upcoming seasons and prevent injuries as we do more. Today, our guest speaker is Amy Stahlman, and she's going to target the topic of posture and breathing. To give you a little bit of background about Amy, she is from the Poconos and has been a physical therapist for 30 years. She works at Results Therapy and Fitness out of Chambersburg and has been with WellSpan for the last year. Currently, she is working in chronic pain self-management and specializing in craniosacral therapy and myofascial release. She also loves to do running rehab. She involved herself in sports medicine because of her personal experience as an athlete playing field hockey and softball throughout high school and college. Amy does not have a favorite sports team, but is more into running and cycling. Before she gets started, just a few housekeeping items to review with you. We will have question and answers, so you can submit those throughout the presentation, or you can wait till the end and we will address those all at one time. And if you have not done so already, please mute your computer. And just for security purposes, the host will also have the capability to unmute you when that is necessary. So right now, I have the honor, the privilege to introduce Amy.
Thanks, Lisa. Thanks, Jess. Thanks, Kyla. Welcome, everybody. I am going to teach a few very basic but very important concepts: posture and breathing. We all have them naturally, and we can all benefit from working on them just a little bit. So what is posture? It's how we align our body to hold up our head against gravity. And we kind of talk about our head because that's where our eyes and our brain are, and that's kind of the center of how we function. But it relates to, it talks about all of your joints. Muscles are the contracting muscles are what help your bones align to create good posture. Good posture can be limited by tightness or weakness of the body structures, and that's something that you want to address, and we'll talk about that. So types of posture. We have dynamic postures, which when we're talking about sports or life in general, it's very dynamic. So you can see my baseball player there. That's a pretty dynamic posture. And static postures are what often we spend our time in outside of sports, sitting, standing. A lot of times, Kyla was just talking about sitting at work. That's a very common static posture. So basics of posture alignment. When you stand up tall, you want your ear over your shoulder, over your hips. Your knees should be directly over the center of your ankle, which gets everything lined up. Here's a picture of a plumb bob or a plumb line. So you can see all those joints. We go by the joints of the major bones. And I'm going to show you well, we'll go ahead and do that right now, hopefully. A good way to practice postural alignment to get started is to go to a door jamb and put your body on the door jamb. So you can see I'm leaning into the door jamb. And as I do that, the back of my head is touching the door jamb. My spine between my shoulder blades is touching the door jamb. My tailbone or my sacrum is touching the door jamb. My knees and feet are not touching the door jamb. Depending on your flexibility, your heels may touch the door jamb. But that's how you know you're lined up. All of those are cues that you can feel those bones of your spine on the door jamb. That's how you know it's a good cue. Your arms are resting at your sides. Your knees should be soft, meaning that they're not locked out, but they shouldn't be bent very much. Just a few degrees of bending is appropriate. I think I said your arms are resting at your side. So as you do a postural exercise, and start in the door jam, just as a cue to kind of like a crutch. And then as you get better at this, you move away from the door jam. And then what you think about is elongation. So you think about being on a string and you're being pulled up by that string, so that you can feel your spinal muscles opening up those joints, opening up the discs, and elongating your whole spine. Then you tuck your chin back so that your ear is back over your shoulder. Your head stays level though, so you don't want your nose popping up in the air. That would be upper cervical extension. If your nose pops up, which is harder, especially as we age, we want to keep that chin tucked. You want to squeeze your shoulder blades down and back. If you're still standing in the door, you'll feel your shoulder blades you can actually pinch the door jamb and get like a little bit of a feedback loop going on with your shoulder blades touching the door jamb. As you move down through your body, you can feel your abs tighten. If you suck in your stomach, you can actually flatten your back. So again, in the door jamb, if you tighten your stomach, you can flatten your back into the door jamb and make sure your back is in a good position. So if your tailbone is touching the door and you can't feel your low back at all on the door, that might be what we call a hyperlordosis, or just a little bit too much arch in your back. And that would be a good place to work on just tightening your abs, to rock your pelvis back and flatten out your back into the door jamb. That works on ab strengthening and also opens up the joints in your low back. I keep doing this as if you can see me rocking my pelvis back, but with Zoom, it's a little tough to show you that. But tightening your abs, flattening your back. Your knees are soft again, and your balance, your weight should be in the middle of your foot, your arch, or toward the front of your foot. Not rocking back on your heels, and not particularly toward the front. You want to be balanced right in the middle. As you get better at that, you could also feel that your feet don't want to be tilting in toward the inside of your foot or tilting out to the outside of your foot. You want to be straight up the middle. If you notice, if you just do it with me now, if you're standing and you shift your weight in toward the inside of your foot, your knees will fall in toward a knock knee position. If you rock your feet out toward the outside, you'll feel you get bow-legged. And so that's why, and a lot of that motion is coming from hip joint muscles, of internal and external rotation of the hip. But that's just something, again, to be mindful. And posture correction and practice is just a very mindful, mindful exercise. So it helps you gain body control. It helps you strengthen your abs. It helps you loosen up like structures. When I tuck my chin in, I can feel kind of the front of my neck being a little bit tight. And that doing that exercise repeatedly will help loosen those muscles. I think I talk about that. Let me go here. Let's see if I go back. Well, let's talk about it now. So another really important thing to do is to be mindful. As I talked about, if I feel like I'm tight when I bring my shoulder blades down and back, I can feel my pecs in the front of my shoulders. They just don't want to move. I feel restriction. A really good thing to do right then is just do some some massage. You can do some myofascial release. That's a little bit more technical, but everybody knows how to do self-massage. So just get your fingers on there and loosen that up. If your pec is tight, it's going to affect your posture, but also your performance as an athlete. And the more you can key into doing a postural check as an exercise, and then working on facilitating or loosening up anything that's tight. If it's tight stretch it. If it's tight, massage it. If you feel like when you try to flatten your back into the door that you just can't make that motion, then work on your abs. Work on that exercise, and that will actually cause a strengthening effect of your core. And it gives you better posture in the process. But it's such a simple exercise, just to stand in the door jamb, stand up tall, tuck your chin, line everything up. It improves your posture. It improves your body control. I wanted to mention a few things about sitting posture because all of us do a lot of sitting. When you sit, it's good to have your hips, knees, and elbows at 90 degrees. Your feet supported on the floor. Your computer screen should be a little bit below eye level, which will help keep your chin tucked and in a good position. We all spend a lot of time sitting. Well, I shouldn't make that anymore. Who knows what everybody's doing. I know my kids were home from school and college, and they were doing all their Zoom meetings in their bed. So they were not sitting at a desk. I tried to encourage them to do that. I think that would have been a better posture than taking a class kind of side slumped in bed. But I don't think I made much impact on that. So just a note about posture. If you're sitting in class well, all those students are going to hopefully be going back to sitting at desks in class in the fall. And the better your posture is in class, the better things are lined up, the better your organs work, your muscle length, all that pays off in the long run. I just wanted to mention a few things about just essentials of posture. You have several curves in your spine. If you look at a spine from the side, your neck has a curve one way, your thoracic spine goes the other, your lumbar spine goes the other. So those are the curves. We're all familiar with those from a skeleton. So your spine curves in and out from the side. A curve that goes from left to right is called a scoliosis. And I wanted to touch on that because I know some of my patients will come in and say, oh, I have a scoliosis. A lot of my patients say that. And the truth is about half of us have a mild scoliosis, and it's really not significant. It could be from a leg length difference or even like a muscle tightness in your back. It's good to know that you have a scoliosis because you want to figure out what's short or what's tight and work on preventing it from getting worse or even resolving it. But don't panic when you hear that word because it's very common. About 3% of scoliosis actually need any attention at all. Postures in athletes. Some athletic performances involve a lot of asymmetrical postures. A lot of us are right-handed, so we do all things in one direction. This is the extreme. You can see this gymnast, her low back is super arched. And so as an athlete, you want to notice if you do things like that and spend some time when you're off the field going in the opposite direction. So she probably spends a lot of time bending forward as a gymnast, but she wants to make sure if she's doing more bending backward that she spends equal time doing bending forward, because it can cause it can actually cause your bones to form or to move in directions that could cause dysfunction later on. So as an athlete too, you also want to think about good posture. Cycling is a good example. We actually fit the bike to meet the person so that it puts you in a good posture, because the better your posture is, the more efficient you'll be. So you can breathe better, your muscles contract better, your balance is better. But a lot of sports, your starting position, your lots of different postures need to be correct, and coaches are perfect for teaching that. So if you have poor posture too, or instability, it can cause deficits in being able to perform. So that's why we want to really focus on getting those postures, those starting positions correct for best performance. Benefits of improving your posture. Physical benefits I've been talking about: muscle balance, You want your muscles to perform better if they're in balance. Obviously, they're at a best mechanical advantage to do the job. Organ wellness, if you're all slunched down on your bed, having that Zoom class for an hour, all your organs are suffering from that posture. Circulatory wellness, your blood supply. If you sit with your legs crossed for hours on end, your circulation is going to suffer from that, which also is the same thing with your nerves. And hormonal balance. If everything, your posture needs to be aligned for the lymphatics and all the nerves to work to get good hormonal balance. Psychological benefits of posture isn't something that we always think, well, it's something we've been thinking about more lately. Amy, I think her name is Cuddy, is a researcher of posture, and she came up with the power pose. So this is Wonder Woman, and she is doing the power pose. There's some research that says that if you power pose, you'll actually perform better. And her research said that there was actually release of testosterone and I think serotonin when you power pose like this. That wasn't able to be reproduced or hasn't yet, but just interesting. So when you're thinking of posture, make sure you think about the psychological benefits too. Tips to improve your posture, you've got to do lots of repetitions. And it's easy to do. Put a little Post-it note on your computer screen while you're working or whatever you do. Put a reminder on your phone. Practice good posture. All you have to do is tuck your chin, sit up straight, stand up straight. I just like an ounce of prevention is worth a pound of cure. That's if you work on your posture, you can prevent a lot of things from happening down the road. And be mindful. It's a thought process. You have to think of posture to improve it. We were talking earlier before the session started about little gadgets that help remind you. They are helpful, but if you get in a habit, put a Post-it note on your screen. Every time you see that, tuck your chin, tighten your abs, bring your shoulder blades back. That helps. So on to diaphragmatic breathing. We were all born diaphragmatic breathing and somehow we lost it. The research isn't really conclusive on why we start breathing with our diaphragms as babies, but they think possibly it's due to the fact that we want to suck in our stomachs and that makes us look better, which is good for your posture, but it's not good for allowing your diaphragm, which is a large dome muscle that attaches to your ribs and your spine underneath your ribs. And I'll show you a picture here. Holding your stomach in does not help diaphragmatic breathing. It's a thought process, again, like posture. You have to be mindful, unless you're an automatic diaphragmatic breather, which there are some people who still breathe that way. It takes mental focus and practice. So here's a picture of inspiration. You can see the diaphragm is under the ribs. And as you contract your diaphragm, it moves down towards your feet and it causes negative pressure on your lungs, which allows your lungs to fill. That's called inspiration or breathing in. Expiration is when you relax your diaphragm. Your diaphragm moves up and squeezes your lungs, and then you release the air from your lungs. It's a passive movement, so it takes longer than inspiration. So diaphragmatic breathing, let's try it. You're going to put one hand on your chest. I'm going to put my right hand. So if you want to be lined up, put your right hand on your chest and put your left hand on your belly, your stomach, just below like your ribs. You'll feel where your ribs come together. You could kind of put your thumb there. So that way your hand is right below your diaphragm. So as you breathe in, you're going to think about expanding your belly into your left hand. But at the same time, you're going to keep your right hand still. And you may just want to take in a deep breath and just notice, is my right hand or my left hand, or are they both moving? So as you breathe in, you want to expand your stomach, let your stomach relax and breathe in. And as you breathe out, you'll feel your hands sink down. This is much easier to do lying down. um, because gravity kind of is less of a component. You have less to think about with posture. If you really struggle with this, try lying on your side, because then gravity actually helps you a little bit. So let's just do that a little bit more. Let's breathe in. And usually you breathe in about twice as long. I mean, you breathe out as about twice as long. So just notice what your usual breathing is. See if your left hand is moving, your right hand is still. Just practice breathing in and breathing out. So that's basic diaphragmatic breathing. And by practicing that at home, when you can be still, set a timer for 5 minutes, relax, just start practicing that. Notice how you breathe naturally, which is kind of hard to do. As soon as you start putting your hands on your chest, you change the way you breathe. But um, just start practicing trying to breathe in with your belly and out and get that going. Now, once you get pretty good at that, you can change what you're doing. You can deepen your breath by spending more time breathing in and then more time breathing out. So you lengthen it, deepen it, slow it down. And then you could breathe in, hold your breath, and then breathe out. So a lot of times I'll breathe in for 3, hold my breath for 3, and then breathe out for 6. And you could do that for 5 minutes. Another thing that's important to know about breathing, diaphragmatic breathing, is you're going to get distracted. Meditation is a lot of times based on breathing, and meditation is a big topic right now because it has been proven to be pretty effective for a lot of reasons. And I'm going to talk about why those reasons are so effective. Oh, wait, I want to go back. Time out. So I talked about the breathing in, breathing out. You could also do breathe in through your belly and then expand your chest and then let them out. So expand your belly, expand your chest, and then relax and let the air go out together. That's another great exercise. It's just building, not only is it strengthening your diaphragm, but it's building body control at the highest level. So Tai Chi is breathing and moving. I wanted to show you just a little bit, and you can look up Tai Chi moves, but if I stand back here, you can see I'm going to breathe in as I bring my hands up. I'm going to rock forward up onto my toes, and then I'm going to breathe out. As I breathe out, I'm going to sink back onto my heels. There's a lot of research right now about Tai Chi, breathing in, up on my toes, breathing out, sinking back on my heels. That's just one exercise or one example. That's called flowing motion. It's a vitality movement of Tai Chi. But the reason Tai Chi right now is such a popular topic is it's preventing falls in the geriatric population, but it's great for everybody. It's breathing, it's coordination, it combines a lot of things. So the benefits of diaphragmatic breathing, I kind of threw this slide in because the diaphragmatic breathing stimulates the vagus nerve. It gets you from a sympathetic nervous system, which is fight or flight, where you can't think well, you're just trying to run away from a tiger. You're not digesting, you just like, that's where you don't want to be. That's only where you want to be if you're running from a tiger, which not many of us do that anymore. You might have an emergency situation that's helpful, but a lot of us function in a sympathetic nervous system response just because we're Americans and we're wound too tight. Diaphragmatic breathing stimulates the vagus nerve, which allows all of these benefits. You can see the vagus nerve goes to all of these different organs. So it has a lot of beneficial impacts. But for us, for athletes, the most important is getting your diaphragm strengthened up, getting control of it. And as you learn to breathe better, you better process oxygen, and that makes you a better athlete. You definitely need oxygen. Here are some other ones that even helps to blood sugar, lymphatics. The mechanical pumping of your diaphragm helps your lymphatics, which is involved with immune response. So, and just a general feeling of calm, which is important. We all function better when we're calm. All right, references. There they are. And I guess we're on to questions. Does anybody have any questions? You're still muted, Lisa.
Thank you.
Thank you.
I have a question about the duration of good posture. What is the amount of time that someone can tolerate holding that posture? Because if we're at our desk for 5 hours, we know that that's impossible to maintain.
Well, the thing about maintaining a static posture is you should change it every 20 minutes. So a lot of us are stuck at a desk at a static posture, standing, sitting, whatever we do based on our job or students in class. So you may have to maintain that for an 8-hour day. But the important thing is that even if you're on a phone or at a workstation, there are ways of changing your posture frequently. And ideally, you do it every 20 minutes. If you're practicing to build better posture, I would start with just a few repetitions of the exercise in the doorway, tuck in your chin. I have patients do 10 chin tucks 10 times a day. So frequently, gently to build those muscles like any other. Postural muscles are designed to work for long periods of time, but they thrive best when they have breaks in their routine every 20 minutes. That answer your question?
Yes, ma'am, it does. Yeah, thank you. And I don't see any other questions posted here. So I just want to thank you for all the information that you brought to us today. You definitely gave us a lot of background and reasons and explanations behind why the posture and the breathing is important to us, static and dynamic. So I thought that was wonderful to hear. And I hope that our coaches that are listening to this today are able to take one component out of this presentation and at least deliver it to their athletes and help them to perform better and feel better.
I hope so, yes. Thank you.
Yes, Amy, so thank you for your time, dedication, expertise. We greatly appreciate it today. And thank you to the coaches who've joined us today. And to give you a little rundown of our schedule, Tuesdays is always our coaches clinic, Wednesday is our total body workout, and Friday is our focus workout. So we'll see you again next week. And our future topics are injury prevention, and then the 8th week we'll do a wrap-up session. So thank you everybody again for joining. Thank you, Amy, and hope you guys have a great day.
Thanks, Kyla and Jess.